Hey everybody, we're going to be talking about the skeletal system today and diving into our human anatomy and physiology unit. This is a really fun unit, and I apologize that I'm not here for class this very first day, but we're going to go ahead and start off with introducing what this is. So our first assessment statement is distinguishing anatomically between the axial and appendicular skeleton. So basically, how is our skeleton organized? And we're going to look at these two areas moving forward. Before we do that, though, there's some basic things that we need to know. First is something that is really interesting, that we actually have 206 bones in our body, and you're going to be able to memorize all 206. Really, it's only 103 on each side. Actually, it's even less than that on each side because the vertebra doesn't count. But we'll get into that. There's 80 axial and 126 appendicular bones, each of which are mirrored, which means we have them on the left side and the right side. The skeletal system is pretty light compared to the rest of our body. It's only 20% of our body weight, and we're going to dive into what it looks like. So these are some notes. Please make sure you grab this slide. You can pause the video when you need to. All this is basically telling you is that the axial skeleton is made up of the skull, the vertebral column, the ribs, and the sternum. Basically everything in the center, if you can look in this diagram back here, the head, the neck, and the trunk, all the way to the end of the tailbone, and the rib cage. But we're not going to include the arms or the legs and the hips. That is all going to be the appendicular skeleton. So feel free to pause this, and then you can move on when you're ready. So what are the actual bones that make up our axial skeleton? Well, just like I said a moment ago, it's our head, neck, and trunk. So you can see them right here in blue. They are very rigid. We don't have a lot of flexibility here, simply because we have to protect all of our organs very, very, very well. Our most important and softest tissue is the brain, so that's in the cranium cavity here. Of course, we have a lot of sensory organs in our skull as well. The backbone, which if I could rotate this I would, but the backbone, of course, houses our spinal column, which has all of our nerve endings that go back up to the brain from the rest of our body. And then we have the rib cage. Your heart sits right around here, just to the left a little bit. And then your lungs come all the way up to the top of your clavicle. You can actually feel them all the way up here, and they finish right around there. Then we have a muscle, actually, that separates our thoracic cavity from our abdominal cavity here. So there's going to be a diaphragm muscle, which allows us to breathe. And in this space right here, this empty space, there's nothing that's going to really protect our stomach, which falls right there. Our stomach is right here, in front and below the sternum. And then our small intestine, and our large intestine, and our cecum. All right, the skull, 22 bones. 8 of them case the brain, and 14 facial bones create our facial structure. We have 1 frontal bone, 2 parietal bones, one on the left, one on the right, an occipital bone in the back, our zygomatic bone, which is kind of like the arch here, the temporal bone, which is where our ear, which is going to be coming or supported, one on each side. The maxilla is the upper jaw, the mandible is the lower jaw, and of course we have our nasal bone that makes up the majority of the face. We're not going to learn all of these. I think this is a little bit more, this will never be assessed. I think this is more informational for you. Okay. The vertebral column, that's the next bone that you need to understand. The vertebral column is broken up into 5 areas, and they match up with the different parts of your whole body. So we start off with the cervical vertebrae. The cervical means the neck. So this is the neck. And we have 7 bones. The very, very first bone is called the axis, and then the second bone is called the atlas, and then the remaining ones are C, 3, 4, 5, 6, and 7. Very, very small, a lot of range of motion. Think about what your neck can do. Then we go into our thoracic vertebrae, and these are going to be the 12 vertebrae. If you know anything about your rib cage, there are 12 ribs that will actually articulate with these particular bones. And so they actually attach back here and they wrap around. Not as mobile, because we don't want a lot of movement to irritate our internal organs. We want to keep that as steady as we possibly can. Our lumbar vertebrae, right here, are 5 very, very large bones, and they actually do a good deal of shock absorption. In addition to all these blue things are called intervertebral discs. And sometimes you may have heard of a slip disc, which causes a lot of pain because bone on bone is then occurring, and you don't want to grind bone on bone. Now this bottom section, we have changed over time because of our evolution. This probably was longer and could have been a tail, could have just been a longer individual. But this is called the sacrum and the coccyx. Now, sacrum and coccyx are fused together. These are 5 bones fused together. And this little tail right here, known as the tailbone, are 4 bones fused together. We have really neat curves as well. The curves in our vertebrae are important. We have a convex curve and a concave curve. And all that means is that if you just had a rigid, straight pole, it's actually not very good for shock absorption. It'll crack. So to allow, like when we walk and run, to allow a little bit of shock absorption, we have a tiny bit of flexibility in all of our vertebral bones. So that's what gives it the curves. So inner curves and outer curves. It's going this way here, and this one's going inwards, this one's going outwards, and this one's going inwards. Okay. Inwards curves are going to be thoracic and sacral. Cervical and lumbar are outward curves, convex, concave. Feel free to pause anytime you need. These are some really interesting and very common issues we see. We have a normal spine here, but if we were, a normal spine kind of has gentle, curvatures, but if we have too much curvature, we might have an over curve. We have that's called lordosis. You see this a lot in pregnant women. And then you see kyphosis, which is very, very arched inward. You see that a lot in our older generation as they collapse over time. Now, looking posteriorly from the back, we should have a really nice, even spine, all the way straight down the center. But you can see for this young lady that she has a lateral deviation, like a lateral pass in football. It goes to the outside. So instead of being straight down here, we have a lateral curve here and a lateral curve here, which is causing a lot of deformity in the way she moves and walks. Don't need to take notes here, just informational. The sternum. The sternum is the breastbone, made up of 3 parts. We have the manubrium, the body, and the xiphoid process. We typically, if we ever have to perform CPR, we sometimes break the xiphoid process and maybe crack a few ribs here and there. So we have 12 ribs total, which means we have 12 pairs of ribs, so 24 individual ribs. Ribs 1 through 7 are true ribs because they attach to the sternum. Then we have 8, 9, and 10, which are false ribs. They don't attach to the sternum, but they do attach to number 7 and number 6. You can see that kind of right here. Instead of coming here and directly attaching to the sternum, They kind of bleed up and then fuse with the ribs above it on the cartilage right here. And then 11 is a floating rib. It doesn't attach anywhere, and neither does 12. We call our ribs costals, rather, just costals, and we have muscles that are in between. Just like when you guys eat ribs, you are eating the meat that is attached between each of these. So that's our axial skeleton, the neck, the trunk, and the vertebrae. Now, what makes up our appendicular skeleton? The appendicular skeleton is our extremities and the girdles that hold it together. So, here you can see our shoulder girdle is made up of our clavicle and scapula and our arms, and our pelvic girdle is made up of the hip bones and our legs. Pectoral girdle, pelvic girdle. Here are some notes for you that explain both of these. The clavicle, also known as your collarbone, and the scapula is on the back, also known as your wings, if you will, or your shoulder blade. The upper body, of course, is the same on both sides. We have 3 bones in our upper limbs. We have the humerus, and notice the spelling, Humerus. That is the spelling for a bone. If you put a OUS in the end, that is the spelling for laughter. So, the humerus, the radius is on the thumb side, always, always on the thumb side, and the ulna is always, always on the pinky side. Once we get down to the wrist, we have 3 sections. We have the carpals, which are your wrist bones, which there are 8 of them. And you can see those here as well. Then we have our metacarpals, just this 1, 2, 3, 4, and 5, the metacarpals. It's kind of like the palm of your hand. And then your phalanges, or your digits. In the thumb we have 2 phalanges, or the distal phalanx, and the proximal phalanx, and then we have 3 in all of the other fingers. We have the proximal, the middle, and the distal for each of the digits. But we're going to call them phalanges. And the nice thing is, these are pretty similar to what we find on our feet. The pelvic girdle has 3 bones. They're like 3 brothers, ilium, ischium, and pubis. The ilium is the wing, the larger part here. The ischium is the lowest part here, kind of that creates the loop where your gluteal muscles will attach on. And the pubis is this very center section here. And then what you're seeing in this light brown color is actually the sacral bones and the coccyx. And it's much easier to see on a 3-dimensional model. This is what allows, this little acetabulum is like a socket, and it allows the head of the femur, which you'll see in the next slide, and to kind of articulate with it, and so you can have feet and legs. So here are your lower body legs, and there's the acetabulum, this little round knob-looking thing at the hip joint. So here's the ilium, the ears, the ischium, the little loops, and the little center part, the pubis. So our largest bone in the body is known as the femur. We have then the patella, which is the floating bone, which is our kneecap. Our tibia, which is the large bone on the big toe side. Tibia, toe. Fibula is a very small bone on the little pinky side, like you say a little fib. It's the fibula. Make sure you keep those straight. Here's a little bit of information for you about the patella. fascinating muscle. We get a lot of knee injuries, so this is an important one to learn about as far as what it does and how it works. The patella is held into place. Actually, all of these bones are held into place with multiple ligaments and tendons. So vital for us to keep that joint protected. And our lower feet. The lower feet are really interesting. We have our tibia and fibula that articulate with our tarsals. These are going to be the ankle bones. So in our hand, it was carpals with a C-A-R and tarsals here. Then we have metatarsals. That's going to be the sole of your foot. 1, 2, 3, 4, and 5. And then we use the same term, phalanges, for our different toes. Okay, and again, the big toe only has 2 phalanges. So this is a little review. Take some time to start learning where these are, what they are, and how to pronounce them, and how to spell them. And we will explore this together a little bit more when I return. Thanks and have a great day.